The sound of knuckles cracking is familiar to many, a sharp pop that often elicits reactions ranging from annoyance to intrigue. For some, it's a habitual practice, a way to relieve tension or simply a nervous tic. For others, it raises a question that has circulated through casual conversations and medical debates alike. Does cracking your knuckles cause arthritis? This question, while seemingly straightforward, invites a deeper exploration into the nature of joints, the mechanics of sound, and the myths that often accompany popular beliefs. To approach the question, it's essential first to understand what arthritis actually is. Arthritis is an umbrella term encompassing a variety of conditions that affect the joints, leading to pain, swelling, and decreased mobility. The most common types include osteoarthritis, which is primarily a degenerative joint disease, and rheumatoid arthritis, an autoimmune disorder. Both types involve inflammation and damage to the cartilage, the flexible tissue that cushions the ends of bones and joints. The relationship between joint health and habits like knuckle cracking is a topic of interest, particularly in the context of myths that have persisted over generations. The act of cracking your knuckles involves a phenomenon known as cavitation. When you stretch or pull your fingers, the pressure within the synovial fluid, the lubricant found in joints, decreases. This drop in pressure allows gases, primarily carbon dioxide, that are dissolved in the fluid to form bubbles. When these bubbles collapse or burst, they produce the characteristic popping sound. This process is completely normal and occurs in various joints throughout the body, not just the fingers. Despite the benign nature of this phenomenon, the belief that knuckle cracking leads to arthritis has persisted. This notion likely stems from a misunderstanding of the relationship between joint sounds and joint health. Many people associate the audible pop with an injury or damage, drawing a direct line between the act of cracking and potential harm. However, scientific research has largely debunked this myth. Numerous studies have investigated the long-term effects of habitual knuckle cracking on joint health, with findings consistently showing no direct link between the two. One notable study conducted by Dr. Donald Unger, an orthopedic surgeon, involved cracking the knuckles of one hand while leaving the other hand untouched for over 60 years. At the end of the study, he found no significant difference in the incidence of arthritis between the two hands. This anecdotal evidence, while not a formal clinical trial, highlights the lack of correlation between the habit and the development of arthritis. Other studies have echoed these findings, suggesting that while knuckle cracking might be annoying to some, it does not contribute to the onset of arthritis. So, if knuckle cracking doesn't cause arthritis, what about other joint-related issues? While the act itself is not harmful, it's crucial to consider the broader context of joint health. Factors such as genetics, age, previous injuries, and overall lifestyle play a significant role in the development of arthritis and other joint disorders. For instance, individuals with a family history of arthritis may be more predisposed to developing the condition, regardless of their knuckle-cracking habits. Similarly, those who engage in repetitive motions or high-impact activities might be at a higher risk for joint issues, independent of whether they crack their knuckles. Another aspect to consider is the potential for joint discomfort or injury from excessive or forceful cracking. While occasional knuckle cracking is generally harmless, individuals who habitually and aggressively crack their knuckles might experience soft tissue irritation or swelling. This discomfort, however, is not the same as arthritis. It's more akin to the strain one might feel after overextending a muscle or joint. Listening to one's body is essential. If cracking knuckles leads to pain or discomfort, it may be worth reassessing the habit. The social implications of knuckle cracking cannot be overlooked either. In many cultures, the sound of knuckles cracking is often met with disdain or concern. People may express worry about the potential health consequences, leading to social stigma around the behavior. This reaction can perpetuate the myth that knuckle cracking is harmful, creating a cycle of misinformation. The reality is that while the sound may be off-putting to some, it is a natural occurrence for many. In the grand scheme of joint health, the focus should ideally shift from the act of cracking knuckles to more significant lifestyle factors that contribute to arthritis. Maintaining a healthy weight, engaging in regular physical activity, and consuming a balanced diet rich in anti-inflammatory foods can all play a crucial role in joint health. Additionally, staying hydrated and practicing good ergonomics during daily activities can help reduce the risk of joint pain and deterioration. As we delve deeper into the topic, It's also worth examining the psychological aspects surrounding knuckle cracking. For some, the act serves as a form of stress relief or a way to release built-up tension. The relief that comes from cracking one's knuckles can be akin to the satisfaction of stretching after a long day. This psychological component adds another layer to the discussion, highlighting how habits can be intertwined with emotional well-being. In conclusion, the question of whether cracking your knuckles causes arthritis is met with a resounding no from the scientific community. The act itself is a harmless phenomenon rooted in the mechanics of joint movement and pressure changes within the synovial fluid. While it may not contribute to arthritis, it's essential to remain mindful of how our habits affect our overall joint health. The focus should be on adopting a holistic approach to wellness, prioritizing healthy lifestyle choices that support joint integrity. As we navigate the complexities of health and wellness, it's crucial to separate fact from fiction. Knuckle cracking, while often seen as an oddity or a nuisance, is a natural occurrence that does not lead to arthritis. Instead of worrying about the sound of cracking knuckles, it may be more beneficial to engage in conversations about joint health, encouraging practices that promote longevity and well-being. In a world filled with myths and misconceptions, understanding the science behind our bodies can empower us to make informed choices about our health.